Hi, I'm Dr. Eleri Davies and I'm Interim Medical Director for Public Health Wales. Good to have your questions today. So our first question is from Anne Leonard. If someone has moderate side effects to the first dose of Pfizer, are they more likely to react similarly to a second dose? So for any individual, it's difficult to say exactly what will happen, but we do know that for the Pfizer vaccines, generally adverse reactions are a bit more common, 2 to 3 times more common, in fact, after the second dose. This differs for the AstraZeneca vaccines, where side effects or reactions seem to be less common after the second dose. The next question from Alison Dite. Do you have figures available or statistics for outdoor transmission or positive tests? So throughout the pandemic, our data has shown that outdoor transmission of COVID-19 is less likely to be a problem than indoor transmission. But we don't have exact statistics or figures to show what that level of transmission might be. We know that transmission of the infection is more common the closer you are to others. Therefore, if you are within 2 meters of another person outdoors, then you can transmit it. But the fact that the air is circulating around you reduces the risk. So the transmission is not completely negligible in the outdoors, but it is less of a problem than in indoor circumstances. So next question is from Sam Coombs. How long after the second Pfizer vaccine does immunity maximise? So after you've received the second dose of the Pfizer vaccine, it takes around 7 days for you to get to maximal protection. But do remember that you get good protection after the first dose, so that between the first and second dose, you do still have a good level of protection. Question from Gail Powell. My grandchildren attend nursery. I previously looked after them, but after the second wave, I stopped. I have had my first jab. Am I safe having the grandchildren? You do get very good protection after 1 dose of vaccine, but the response is not immediate. And of course, the risk doesn't completely go away. So you must always remember that. However, wait for 2 to 3 weeks after being vaccinated for the best immune response. For Pfizer vaccine, you're well protected against symptomatic disease between about 15 to 21 days after dose 1, and for AstraZeneca from day 22 after dose 1. So you have a very good protection after 2 to 3 weeks. So Nancy Harris has the next question. We have had our first vaccine and just want to know if it's possible to mix and match the second dose. So currently, guidance says that anyone that has already received the Pfizer-BioNTech or Oxford AstraZeneca or Moderna vaccines should make every effort to get the same vaccine for both doses. There are studies underway to see if giving people different COVID vaccines for their first and second doses works as well as the current approach of using the same type of vaccine twice. Where the same vaccine is not available, if there are any supply problems or anything like that, then you are, or if you are at high risk or unlikely to be able to attend again, then completing your second dose with what is available locally should be considered. But at the moment, the main message is that we should be trying to stick to the same type of vaccine for the first and second doses. Question now from Jeanette Hurley. As many people are asymptomatic, they could have had the virus when they are called in for the vaccine. What effect, if any, would this have on their body? So if you have antibodies following natural infection, receiving a COVID-19 vaccine would be expected to boost any pre-existing antibodies. And so far, there's no evidence from the trials of any safety concerns resulting from giving a vaccine to somebody who's already had COVID-19. So it would just serve as a booster. Thank you very much for sending in your questions. I hope you found this useful, and stay safe.